Hello all, I am Dr. Monica Vij, Professor of Geography at Miranda House, University of Delhi. Today we will continue with our lecture on occupational health and safety. In the last lecture we had talked about all kinds of types of health hazards and some figures at national and international level. Today we will talk about the preventive measures about the same topic, occupational health and safety. When we talk about preventive measures, we realize that there are various preventive measures which can be taken up. Number one is education. In terms of education, we have to get people to think safely. That is, they have to assess where is the place they are working, what are the possible kind of hazard which can be possible, what is the risk, how vulnerable they are to any particular risk at that particular place, to create safety awareness, and of course to create safety slogans and posters which will give them awareness. Second significant preventive measure is skill training. It is very important that in terms of sufficient training is given for accident prevention when skill training is given to new recruits in a particular office. But there are certain industries like the construction activity particularly wherein falls or accidents are very common. And probably, of course, they are preventable, but they are very common to happen. So, in that kind of a work environment, it is very necessary that the workers are given sufficient training so that in case of a fall, how well they can protect themselves, particularly protecting their vital organs, their heads and their heart and various other vital organs. So, that kind of an training, accident prevention training has to be incorporated right at the beginning in the learning process. Secondly, they have to be provided with skills required to handle dangerous machinery and chemicals. When we talk about prevention, there are, besides education and training, there are various occupational preventions which can be done, that is medical measures, engineering measures, occupational safety, legislative measures, social security measures for workers and others which we will be talking over the due course of time. In terms of prevention, it is believed the best cure is the 4-step system of SAFE, S-A-F-E. S stands for spot the hazard, A stands for assess the risk, F is fix the problem, and E is evaluate the results. We can see it with examples. First of all, when we say spot the hazard, how do we spot the hazard? We find that very often people at their workplace are complaining continuously of some or the other issue. This could be things like headache, perpetual headache, body ache, fatigue, peptic ulcers, increased BP, increased heart-related issues, anxiety, depression. This is spotting the hazard. And how do we spot the hazard? We come to know by listening to people. Sometimes we find that people are constantly complaining about that how emotionally exhausted they are. This could be related to some mental problems, mental health hazard existing at their occupational level. Similarly, we also hear that I feel stress, I am burnt out, there is undermining of my confidence, there is I am feeling bullied, I am feeling harassed, there is lack of role clarity, there is poor support, there is too much of job demand. So, there is lesser recognition. All these things could be because of a mental health issue at the workplace, or could also be physical issue which is getting converted into a mental health issue. So, we need to spot the hazard, and that's for spotting the hazard each one of us, not only the employer but the fellow colleagues, have to be very vigilant as to what is leading to these kind of responses from the fellow workers. So, these kind of issues, mental health as well as physical health combined, might lead to poor relationship problems, and that relationship problems might affect both at the family level, personal level and at the colleagues level. So, first thing which we have talked about is spot the hazard, that is S within SAFE. Second is assess the risk, that is try and assess what risk can be possible. This we can understand with the help of the chemical hazards at the workplaces. And we find that there are various sources of chemical hazard. They can be food allergens, they can be marine toxins, they can be pesticides from the vegetables which we get home. There are food additives, there is chemical contamination, there is environmental chemical hazards, there is air pollution which is taking place all over the city. So we have to assess the risk, what all possible. So we do find that there is a lot of awareness generation, a lot of education which goes on, that you have to wash your hands, you have to wash the vegetables. These are all because there is high amount of chemical hazard sources within our food allergens and within our food products. So we find that in terms of the assess the risk, we find that there is a large number of people in the working age group of 15 to 45 who are at a major risk of dying because of chemical hazards. So we have to assess and we have to take necessary steps for it. So within SAFE, the first is spot the hazard, second is assess the risk, third is fix the problem. When we talk about fix the problem, we can take the example again for the chemical hazard at workplace, and we find that these problems can be fixed very easily. And how? First of all, by writing very clearly that safety first, these kind of symbols. Secondly, writing very clearly that replace all damaged or defected labels, never mix chemicals, familiarize yourself with the color and characteristics of the chemical products you use. Each chemical bottle has to be well labeled so that people can understand that this can be toxic, this can lead to fire, this can be, it has oil in it, this is highly inflammable. Various kinds of, the labeling should be done so that we can ensure that what kind of harm can a particular chemical cause. So within prevention, we've talked about spot the hazard, assess the risk, fix the problem, and evaluate results. Then the next thing we talk about is medical measures. Very often we find in case of any occupational hazard, the first thing to respond is that we go immediately rush to the hospitals, and we realize that who are the people who are at maximum risk, and we find that the maximum people who are at risk are healthcare and housekeeping personnel and the waste workers, doctors, nurses and technicians. They are constantly at risk because of various injuries which might be caused to them, that is needle stick injury, musculoskeletal pain. We have seen the nurses working in very odd postures where we find that for putting up the injections or putting up the various drips and other efforts at reviving the patient, curing the patient, the postural conditions of the nurses is extremely harming to their body. Then work related illness because of long working hours. Then there are the stress and overwork, and the worst is respirable infectious diseases, which are very common among health workers. So when we talk about medical measures, we have to be extremely careful that what are the pathogens which are there in the environment, what are the infections. Post-COVID, luckily, we have all become a little more vigilant about the infections, and we do not shy away in asking a person that if he or she has some infection, we do not mind by saying that you please put a mask so that the infection does not become contagious to other people. There are various kinds of viruses, there are blood-borne diseases, contamination of water and other food items. These are all sources of occupational hazards which can affect the bloodstream as well as the skin and various other organs. So in terms of preventive measures, we find that again, talking about the chemical hazards, we find that these are simple symbols which can be put up on various chemicals, like this particular symbol, whether a person can read or understand English or not, but these kind of symbols like which says that it can explode, this is oxidizing, this can lead to fire, this is going to corrode a particular surface, this is very dangerous for the environment. You can see trees have been de-leaved and the fish is dying. So we understand that there is some kind of toxin which is there in the environment. Then this particular big cross can simply mean that this is harmful and not to go there, it's prohibited. This is bigger fire, highly inflammable, this is toxic, irritant, highly toxic. So these kind of symbols, if we put at various places, if there is any issue, people can understand and can be very careful. Then we talk about engineering measures or ergonomic measures. So here in this picture we can see very clearly that there are very simple engineering measures which can be taken up, like design of a building, what kind of stairs are there, what kind of ventilation is there, how much sunlight comes into there, what is fresh air, amount of fresh air which is coming to that particular building. These are very significant issues which might lead to health hazards. There is good housekeeping, whether enough cleaning is taking place or not, dustbins are being vacated or not. This is good housekeeping which is extremely essential, because when we talk about viruses and bacteria, if the housekeeping is not good, we do realize that there are various kinds of diseases like dengue and various other things which mosquitoes will generate and will lead to various kinds of virus and bacteria and various kind of infections which will affect human beings, because largely the largest number of hours which we spend in our waking time, we are spending at the workplaces. Then we've talked about ventilation, then mechanization. Wherever there is possible that mechanization can be done, hard human labor should be avoided. That is again possible with engineering measures. Then there is dust has to be removed, enclosure has to be very carefully done, that if there is an enclosure which is done, what is the supply of air, from where air is coming in that particular enclosure. Isolation, sometimes isolation is good but not always. A worker should not feel extremely isolated, which might lead to health hazard, or sometimes people do need isolation for working. So it is very essential that the work environment is very sensitive to the requirement of the work or of the individual. Similarly, local exhaust ventilation is very necessary. There are protective devices like helmets, gloves, shoes, masks, sanitizers. These are certain protective devices which are needed for sound, for light, which are very significant and should be used. Then there should be enough research in terms of engineering measures, that if a particular workplace is experiencing that there are too many workers who are falling sick or who are facing accident, then there should be research done, that what is the reason that so many people are falling sick. And that research will help them to identify, assess the risk and spot the hazard. Similarly, there is statistical monitoring which is very essential. That is, it is because of these statistical monitoring that we have come to know that asbestos leads to lung infections, and there are the dust pathogens will lead to so many problems. And it is statistical monitoring which has led us to believe that the parali which is burnt in Delhi and NCR region, which leads to immense amount of exposure to unnecessary pathogens and air pollution. So the schools are closed and the colleges are closed during that time, so that the children are not exposed to this kind of. So this statistical monitoring, what is the time period, and that is why we realized that during Diwali it is said that the chemical component in the air increases, so you have to reduce firecracker burning or the introduction of CNG. This is all possible because of research and statistical monitoring, which has led to improvement. And of course environmental monitoring, and we do find that in our modern language and common parlance, we are using terms like air quality index and various other things, which is helping us to understand what is the kind of environment within which we are living. Within engineering measures, we also have, we have to understand that what is the design of a particular equipment. What is this particular picture shows, it says match the man to the job. That is, try and assess, and here in the picture we can see that a lady is helping another lady to understand what is the eye level at which she can face the desktop screen. So if the desktop screen is too high and the person is short, she or he will have to really stretch her neck. So this will lead to her cervical issues. Similarly, a person might, if a person is very tall, he might have to crouch down and sit. There might be people who find a particular machinery or equipment to be very highly placed. So he or she will have to stretch himself unduly, harming his musculoskeletal system. So there should be proper stairs or proper support system, so that it does not lead to musculoskeletal disorders. This particular picture shows very clearly that backbone and backache is the biggest disorder. Although it is associated with women generally, and advertisements are making money out of it, that backache is related to women, but we find that musculoskeletal disorders are the maximum both among men and women, and it is not related to a particular gender but a particular work environment. That work environment can be at home, or that work environment can be in the office or the workplace. So in these kind of systems, we have to access various kinds of control, and this particular inverted triangle talks about hierarchy of controls ranging from the most effective control to the least effective control. The first most effective is elimination. That is, when we talked about the concept of safe, that is, first of all, spot the hazard. So if you have spotted the hazard, eliminate the hazard, physically remove that hazard. Second is, if you cannot remove the hazard, you need to replace it with something else. So substitution. So first is elimination, second is substitution, replace the hazard. Number 3 is engineering controls, that is, isolate people from the hazard. We took the example of the desktop and the chair and the seating arrangement. So isolate people from the hazard. Put up situations wherein people are not exposed to that hazard. So if in a construction industry it is known that a person is working in a very risky environment, give him or her a proper harness, so that in case of a fall, we find that painters who are working on tall buildings very often do not have harnesses. So give them a proper harness. This is isolate people from the hazard, so that you have spotted the hazard, you have assessed the hazard, now you are fixing the hazard, you are giving some kind of an equipment so that the person is protecting himself from that particular accident or from that fall. The fourth important control is administrative control, that is, change the way people work. We find that very often it is one of the most simplest control or preventive measure which can be done. We find that workplaces are very crowded, there is not enough privacy for people to be sitting, and places are crowded. Now that privacy sometimes is very much needed for mental health and for peace of working in a particular environment. So that is an administrative control, that you see that how many people are working in a particular office, in a particular room, what are the shifts, how many hours a person is working. Particularly in industry like guards and safety industry, safe industries, we find that the guards are put up on a duty, night guards are put up on a repeat duty on daytime also. So very often there is the sleep quality, the sleep duration as well as the sleep quality is not enough. People working in the night shifts, they are repeatedly put up on night shifts, which affects their biological rhythm of sleep, which leads to mental health issues and various other cardiac issues also, because the body is not resting enough. So we have to change the way people work. That is a simple administrative control, but for that sensitivity, sensitization of the employer is extremely necessary, employer as well as the managers. And the last control is PPE, which is called as the personal protective equipments. PPE terminology became very common during COVID times, very unfortunate times, but it helps the worker because that particular worker is wearing enough protective equipments. And protective equipments can be very simple in terms of the helmet or proper eye glasses or equipments to prevent from noise pollution, or good shoes, gloves. All these things are very significant. Even people working at our home in terms with detergents, and people working with floor cleaners, with phenyl and various other things, we are not putting enough attention to that, but these are again a very significant health hazard at the work environment, and that work environment for the domestic worker at our home that is her or his work environment, where we are not giving enough protective equipment for safeguarding. The next significant preventive measure is in terms of legislative measures. Government of India has released its Occupational Safety, Health and Working Conditions Code 2020, where the code regulates the wages of the workers, industrial relations, social security. When we talk about social security, we talk about compensation and insurance, occupational safety, health and working conditions. When we talk about working conditions of the pregnant women becomes very significant, the menstruating women, whether the toilets are there or not, these become very significant, smaller issues, but they become very significant issues when we talk about health hazards, health and safety hazards at the workplace. So when we talk about preventive measures, this is duty of the employee, duty of the employer, so that there is no misuse or neglect of any safety appliances. There's cooperation with the employer in meeting the statutory obligations. Sometimes the employer puts up all the regulations, but the employees become very negligent and very careless about, they are not well aware about the need for wearing a particular protective equipment, or they would want to not spend money on wearing this protective equipment. So there has to be cooperation both of the employer, employee as well as the fellow colleagues, so that we can take proper measures. There should be sufficient reporting of any unsafe or unhealthy situation. Very often we see that a possible, we assess that the hazard might take place. We have spotted the hazard, but somehow we have just forgotten to report it. We find a small wire which has not been insulated enough, and we find that in our next to our desk, but we have just neglected it and we have not reported it, and probably we find that there is a short circuit which has led to a major fire hazard within the work environment. So it's very significant that we report of any unsafe or unhealthy situation which exists around us, with our fellow beings. And there is necessity that we comply. There should be 100% compliance with safety and health requirement. And for that, people have to be educated and vigilant enough so that they can bring it up to the employer, bring it up to their fellow colleagues. When we talk about legislative measures, there are various laws like the Factories Act of 1948, the Contract Labour Act, the Mines Act, the Dock Workers Act, the Building and Construction Workers Act, the Plantations Labour Act, the Newspaper Employees Act, the Working Journalist Act, Cinema Theatre Workers Act, Motor Transport Workers Act, the Sales Promotion Employee Act, the Beedi and Cigar and Tobacco Workers Act, and various others. There are various acts and legislative measures which are there, but we need to see that how well they are implemented, and that will depend how aware we are, how sensitive we are to these kind of issues, because the laws are there, and till the time we do not demand that these laws are implemented well, our health and safety will always be compromised at the workplace. Then we find that with the emerging trends and emerging technology, we find there are newer occupational health hazards which are coming up. With technology, particularly with artificial intelligence and robotics, there are both negatives and positives. First, we talk about the positives. The positives is that because of the artificial intelligence and robotics, there is enhanced safety through automation and predictive analytics. We find several equipments now which give pre-warning that a fall is going to happen, or there are wearable devices which will monitor workers' health in real time. In terms of AI and robotics, I will give a simple example of the modern day cars, where we find that if the door of the car is not locked properly, it will keep blinking, or it will keep making alarm in the car that your door is not locked properly. Or if you're not wearing the seat belt, it will continuously ring an alarm that you're not wearing the seat belt. It is a kind of a hazard. So similar kind of alarms, similar kind of predictive safety automation can be done for various machines and various equipments at our workplace, which will reduce the number of accidents taking place and the severity of the accidents which take place. Similarly, there are various wearable devices which can monitor health in real time. We are using watches these days which tell about the heart rate, it tells about the BP, it gives you a warning about an increased noise decibel which might be harmful to your ears, and various other health monitoring like your sleep quality, number of hours you have slept, what was the sometimes these watches are also able to give you an idea that there is a fall possible. If you're walking in a particular manner and your gait is not right, it will give you an alarm that you are about to fall. So these kind of monitoring devices will help extremely to the industry, particularly those industries where people are working in a very dangerous environment. The technology for these monitoring devices might be expensive right now, but if with the increased demand and with the increase in technology, the prices will come down and it will become very wearable and very affordable to people, and it should be used as much as possible. Another newer health hazard which is coming is in relation to the remote work or the hybrid pattern of working, wherein people are working 3 days from home, 2 days from office, or months together from home. So these are leading to several challenges, both in terms of physical health challenges and mental health challenges. We do find that we have, in our earlier slide, we have talked about ergonomic changes in the work environment, where we are saying that the chair or the table height should be adjusted to the physical requirement of the employee. But what about those requirements when the employee is working from home? Probably a setup is very good at the office, but the setup to work from home is not good. Probably the number of rooms or the size of the room is not enough, or the lighting is not enough for a person to work. So these are various issues which might lead to physical health challenges, as well as it might lead to mental health challenges. Very often the work environment at home is not so easy, for a worker to work continuously for long hours. So those challenges have not been looked into very carefully, and those need to be thought about. So integrating occupational health with environmental sustainability initiatives is also something which is coming up very recently, and it's a very commendable work that people are talking about green buildings, and we are talking about eco-friendly practices, because we do find that with the change in climate, with the extremities of climate change, wherein we find heat waves during summers and extremely low temperatures during winters and prolonged winters, we find that the buildings are not equipped enough, there's not enough sunshine, the temperature is not controlled, the clothing is not in relation to a particular weather, which might lead to a lot of disabilities and various problems in the work environment. So we have to become a little more aware about, and we have to take initiatives about those green buildings and eco-friendly practices, so that we can keep occupational health and safety into consideration. When we talk about sustainability and climate change and these issues, we do find that industrial safety and sustainable development goals are clearly linked. Out of 18 sustainable goals, majority of the SDGs, they relate to industrial safety and health, because after all, sustainable development goals are also talking about the planet, about people, and about prosperity. So when we talk about sustainability, without people and prosperity, sustainability cannot be managed. So it is very significant that the quality of life is taken into consideration. The sustainable livelihoods and livable communities are taken care of. There is safe production, there is safe data transfer, so there is safe interaction between humans and robots. Now robots are also a reality, and we have to consideration that how these AI and robotics are going to affect our mental health and going to affect our work quality. So when we talked about AI and robotics, I said there is both positives and negatives. There we had just talked about the positives, but with AI and robotics, there's large amount of negatives also, wherein the human beings at the workplace are constantly getting threatened because of a large presence of robots in the work environment, and there's a constant fear or threat that the robots are of course performing much better than the human beings. So the fear of losing the job, leading to stress, mental stress, anxiety, depression, aggression, all these things are becoming more common at the workplaces. So we do realize that after hearing all types of occupational health and safety hazards which are possible at the workplace, we find that there are several reasons that we consider this particular topic to be of prime significance. There are primarily, we can right at the outside say, there are 4 main reasons to manage health and safety. The first reason is of course a moral reason. It is our moral obligation to ensure that the workers are not exposed to unnecessary risk or hazards that could harm their physical or mental well-being. Of course, there is financial reason. By managing health and safety, businesses can prevent or minimize the cost of accidents and thus reduce the financial losses. There is legal reason, that it is a legal binding to provide a safe and healthy workplace for workers. Failing to comply with legal requirements can result in serious consequences, and we have seen that there are various tribunals and various committees which look into what is the safety measures which a particular employee has taken in his workplace. And of course, there is reason is sustainability reason, that is managing health and safety is essential for creating a sustainable workplace. This can lead to improved business performance and sustainability. So we should be extremely thankful to all our frontline workers, particularly our nurses, our sweepers, our construction workers, doctors, miners, cleaners at home, and these days the gig economy, the Blinkit people and the Zomato people, it is a working environment for them is on the roads, continuously they are speeding their vehicles. That is another kind of occupational hazard which is coming up, where we are not paying any attention. Whatever weather condition, they are rushing their automobiles to deliver a particular product. This is again, so we have to be really very vigilant for all kinds of frontline workers, on the field workers, and of course within the offices we have to be very vigilant for ourselves, for our fellow colleagues, for our employees, everyone around us, that we reduce the risk of occupational hazard and we move towards greater awareness, training, skills, so that we ensure safety at our workplace. Thank you very much.